And hello and welcome along. Hi, it's Kathy Frey and welcome along to this week's live webinar with Maternity Natural Health, hosted by IMCO, the International Integrated Maternity Healthcare Organisation. And today I'm very pleased to introduce to you an exciting new speaker with us, and that is Eve Johnson. Eve, say hello.
Hi, everyone. Thank you, Kathy, so much for having me.
You've got such a good relevant topic that we're going to be talking about, and I know you've got a PowerPoint presentation that you're going to go through about improving menstruation before conception. And we certainly, particularly in the Us the Maternity Gurus forum, receive so many queries around fertility and subfertility and infertility. And you're going to be starting this right at the basics of, you need to have a cycle that's working properly, and of course the ovulation cycle and the menstruation cycle, all kind of interconnect, but so often women are thinking about their period and not so much thinking about their ovulation. But to just do a little introduction. So Eve has a bachelor, she can go over her degrees, but basically she's a very talented lady in Chinese medicine. And we were just discussing this in the green room before coming through, but I often say to women, if there's one thing that you really want to invest in that preconception preparation before you're trying to conceive, it is seeing a naturopathic therapist. And to me, it's always says, look, it doesn't matter if it's a European traditional medicine herbalist, or it's Ayurvedic Indian herbalism, or it's traditional Chinese medicine. I don't care which path you head down, but head down our path, because it's all about creating that wellness. And Eve is really quite passionate about that menstrual health and educating others on traditional Chinese medicine and what is a normal cycle. And for those of you who are familiar with Julia Bartrup, Dr. Bartrup, who has done quite a lot of integrated medicine webinars on some real detailed topics here. She's amazing. And Eve works with her. So we're very pleased, Eve, to have you along today. And this is your first presentation with us, and we really welcome you to the team. So thank you for volunteering your time.
Thank you, Kathy. I'll share the PowerPoint now.
Fantastic. And feel free to reintroduce yourself a little bit too. And for those of you who have any questions today, just remember that there's that Q&A button usually at the bottom of your screen. So type it in there, and if you do have any questions, we'll make sure that they're answered during the live session. So thanks, everybody, and thank you so much, Eve. I'll hand you over.
Awesome. Thank you so much, Kathy, again.
Oh, we've gone back. We've lost the share screen.
We've lost the share screen. Okay, sorry. Is it up?
That's
okay.
it. Yay.
Okay, so I am going to introduce myself a bit more in a second, but first I just want to say that I'm presenting from Australia, where we like to do an acknowledgement of country before meetings to show our respects and hopes for reconciliation and a fair treaty with our Indigenous people. So I'm just going to quickly do one of those. Okay. I would like to acknowledge the traditional owners of the land on which I conduct my business. That's the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging. I'd also like to extend this respect to any Indigenous people from around the world who may be present today or watching this webinar at a later date. Welcome and thank you. Okay. So I'm a Chinese medicine practitioner. I graduated from RMIT last year, I have 2 bachelors. One is in health science and the other is a Bachelor of Applied Science in Chinese medicine, which is what you need to be able to call yourself an acupuncturist and Chinese herbal medicine practitioner in Australia. I'm working in Eltham, as Kathy said, with Julia Bartrop, who some of you may know. She already has done a few of these webinars already, and some contact info up there as well if any of you have any questions or anything. Okay, so today we're going to be talking about a few different things. Firstly, we'll cover BBT charting, which some of you may have heard of before. I know Julia's definitely talked about it. And I'm also going to talk about how menstrual health is an area that seems to get less attention than it needs. People are told conflicting things all throughout their life and basically end up feeling not listened to when they do have a problem. They may even have an idea about what a normal period is, not realizing that many different definitions of a normal period are far from what we Chinese medicine practitioners would consider ideal. So today we'll be talking about this ideal cycle and some common issues people have and what Chinese medicine can do about it. I also want to briefly touch on the fact that one of my favorite aha moments that I had at uni was being told period pain is not normal and it should be addressed every single time. So it's really important to me that people understand that you have to address it and you should do it as soon as possible, at the very least a couple of months before you start trying to conceive, so that we can really get to the bottom of what's happening and then worry about conception after that. Something I've been experiencing since I began practicing is that people are often coming to us pretty late in their conception journey and want to do everything they can every single month to try to conceive. This gets tricky for us because not every treatment is advisable during the early stages of pregnancy. So even if the patient doesn't know yet if they are pregnant, but knows that it's possible because they've been trying, this can greatly limit our treatment options. So I hope after this presentation, you'll understand a bit more about the menstrual cycle from a Chinese medicine perspective and be prepared to come in yourself or refer your patients early where you feel it's appropriate. Okay, BBT charting. So we ask all our patients to BBT chart, which is to measure their basal body temperature when they come in for anything that's related to fertility or menstruation, hormones, because it helps us get a good idea of how long their cycle is, how long each phase of their cycle is. To measure their BBTs, the patient has to take their temperature each day when they wake up. And this establishes a trend throughout the month by inputting their temperatures into an app such as Fertility Friend. That's the one we always recommend. We're able to see the changes in their BBTs and draw a cover line to help us determine when they ovulate. So I'm going to show you an example now. Okay. As you can see, there's a clearly marked follicular phase. Can I? Can you guys see my mouse?
Yep, that's all good.
Okay, great. Okay, so you can see the clearly marked follicular phase is this one here. And then the cover line in the middle is where the app is determining ovulation to be. So sometimes there'll be a bit of a drop before it spikes up into the luteal phase, but also we're looking for that mucus around ovulation as well to help us determine when that is. You can also see down here, these red boxes indicate which days the patient is menstruating on. So we're going to take a closer look now as we discuss the Chinese medicine version of an ideal cycle. Okay. So basically what we're hoping for is each cycle to be as consistent and close to each other as possible. This is in terms of number of days total and the number of days for each phase to ensure that the cycle of hormones is regular and standard for the patient. And so ovulation can be accurately predicted for future attempts at conception as well. All right, first phase, the follicular phase. This includes the menses, menstruation. So we want day 1 to start as a reasonably heavy bleed. That means no spotting beforehand. The period should last about 5 days and get a bit lighter each day. And on the last day, it should stop completely. Again, we don't want any spotting at the end of the period either. The follicular phase sees a rise in FSH and estrogen, and the follicle finishes preparing to release the egg. So this phase should last around 12 to 16 days, including the period. And the ideal BBTs during the follicular phase are between 35.9 and 36.4 degrees Celsius. In Chinese medicine, we describe the follicular phase as the time when there is a lot of yin energy, which may need to be supported if the patient has a follicular phase issue. If anyone has any questions about the terms that I'm using, Chinese medicine can get a bit confusing if you don't have much experience, so please raise your hand and let me know. As you can see from this section of the BBT chart from before, this person's follicular phase was about 16 days long, which is on the longer side, but it's still acceptable. Their temperatures during this phase are between 35.9 and 36.2, which is good. Okay. Next, we're going to talk about ovulation. Ideally, this will happen between days 13 and 15. This is when we'll see a spike in the BBTs, which we want to be clear and quick. There should be some thick mucus to indicate ovulation as well. And I just want to make a note about how you may see a pattern of one cycle's longer and then a shorter one and then a longer one and then a shorter one again. Some people think that this might mean that their cycle is irregular, but that's not necessarily true, because it may just indicate that one side or one ovary is operating more effectively than the other, because a lot of women ovulate from one side and then the other side and then back to the first side again. So this is why it's preferable to have multiple cycles charted so that any patterns can be identified and we can work on the different cycles in a different way if we need to as well. In Chinese medicine, we think of ovulation as the time when the yin energy transforms into yang energy. That's why we get the temperature spike, because yang energy is very warm. Okay, for this part of the BBT chart, you can see that they ovulated around day 17. This seems a bit late, given what I just said, but we're about to learn that the luteal phase length is the most important, and a late ovulation is okay when the cycle is a bit longer as well. All right, the luteal phase. This is the one that's the most important in terms of the length. It has to be at least 12 days, preferably 14, but not really more than 16 days. We want to see a significant rise in temperature, at least 0.5 degrees Celsius on average. And we want to see endometrial line thickening as well. This should be at least 8 millimeters thick if it's going to support a baby to term. The ideal BBTs during the luteal phase are between 36.6 and 36.8 degrees Celsius. In Chinese medicine, we describe the luteal phase as the time where there is a lot of yang energy, and this might need to be supported if the patient has an issue during their luteal phase of their cycle. All right. As you can see from this part of the chart, the luteal phase is on the longer side. It's about 15 days, but their temperatures spiked fairly quickly and stayed high until the first day of their next period, where they dropped back down over here to 36.3 degrees. So that's good as well. We'll talk a bit about different kinds of luteal phases in a bit. All right. Are there any questions so far?
No, I think we're all good. So people will just type them in if they've got any questions, but you go for it. It's really good. Thank you. And I love those comments about the fact that, you know, you can have this, what people often think is an irregular cycle. And, you know, and when they click to that fact that you've got ovaries that are taking turns, and when you know, track that cycle over a few months, then suddenly it's very obvious that, say, for example, the left ovary is on a 28-day cycle and the right ovary is on a 35, 28, 35, 28, 35. And you're like, oh, wow, there is a regular cycle going on. It's just that it's not taking turns. And it's like just those, isn't it sometimes just the most simplest of information, and it's so empowering. A woman go, I don't have a irregular cycle. I have two different cycles that regularly cycle.
Exactly. Yeah. And it's really good to see when that does happen. Sometimes then we're able to recommend that these women try on their good cycle and take a break on their less good cycle so they can, you know, have some fun and feel good about what they're trying to do, because they have a better chance of getting pregnant on their better cycle. If
that's a great idea. Yeah, because sometimes you just do need time off from that. You know, because it's such an emotional journey that every week you're in, you know, you've got your period and then you're waiting, and are you ovulating? Now you're ovulating, and then you're trying to conceive, and then you're waiting and waiting, and I'm like, is this, oh no, the cycle arrived. I didn't get, you know, it's just, isn't it? It's every month, it's this huge emotional roller coaster.
Definitely. And then all of a sudden you're also intimate with your partner, just trying to have a baby, not because you both want to as well. So it's important to consider that as well, because
it really impacts the relationship, doesn't it? Because suddenly he starts to feel like he's just a sperm donor. And so that's a lovely idea. Anyway, I will be quiet and let you continue.
All right. Before I get stuck into this section, I just want to re-say that Chinese medicine has a different way of talking about disease. So if any of my terms don't make sense or you like clarification, please ask. But let's get into it. So first thing I want to talk about is if the period is too short. That's if it lasts 3 days or less, we consider this to be too short in Chinese medicine. And for this kind of cycle, we usually talk about blood deficiency. So our treatments will be focusing on building blood. Blood deficiency can affect people's chances of getting pregnant or even staying pregnant. So it's often important to try and improve this part of the cycle before they try to conceive. And as you're going to hear a lot over the next few slides, we recommend regular acupuncture and herbal medicines as well to help build the blood in cases like this. All right, if the period's too long, this is if it's 7 days or longer. For this one, we consider it to be what we call qi and blood stagnation, which is kind of just saying that your circulation needs to be improved. We say free flowing the qi and blood. Qi and blood stagnation can have other effects on people's menstrual cycles and bodies, such as body aches or digestive issues. So we definitely want to address that as well. Treatments for this kind of condition are not usually recommended during pregnancy, which we'll talk about the precautions to take during pregnancy a bit later. But I just want to say that it's very important that patients consider committing to these types of treatments and stopping trying to conceive for a little bit if that's what they need to do. Again, acupuncture and herbal medicine will always be my recommendation. All right, period pain. So I know that for me and a lot of my peers, we've been told by various health professionals that period pain is normal. In Chinese medicine, it's always considered abnormal and something to be addressed every time. It's just common. Lots of people experience it, but that doesn't mean that it's normal and something that you should just put up with and not think about. There are a few possible causes from a Chinese medicine perspective. So we might do treatments that are more nourishing if that's what the patient needs. We'll determine this based on their other symptoms. Like I said before, stagnation can cause other pain or digestive issues. That's when we need moving, what we call moving treatments. That's moving the qi and blood. So because there's multiple causes, we will have to consider the patient's conception journey, as sometimes these treatments might be inappropriate if they're already trying to conceive. It can take about 3 full cycles to see lasting changes in the cycle. So it's good to recommend acupuncture early, or at the very least not wait until after IVF consultations have begun, because often by then people aren't really interested in taking a break. All right, back to the BBT charts. So when the BBTs take a few days to jump the required ½ a degree, this is a sign that there's a luteal phase defect. Either the luteinizing hormone or progesterone might be low. So from a Chinese medicine perspective, this is indicative of yang deficiency, and treatments will focus on warming the patient and ensuring they have enough yang in their future cycles. So as you can see, this BBT chart shows that they have a more gradual spike in their temperatures. They don't even reach 36.5 degrees until all the way over here, day 4. Well, day 4 after ovulation, that is, of course. And you might think that that means that it was hard to determine when ovulation was, but as you can see, this patient had mucus on these days, so the app at least, and I would as well consider ovulation to be around day 17. Right. If the luteal phase is too short, that means that it's less than 12 days. This has a similar implications for the patient to the slow temperature rise, and that's really showing us why we get the patients tracking their BBTs so that we can see exactly how long each phase is and if there are any investigative tests to consider, because we might want to check their hormone levels to see how their progesterone and everything is doing. Yes, we'll be using acupuncture and herbal medicine for these as well, unsurprisingly. But again, it's going to take at least 3 full cycles of treatment to see lasting changes in the patient's cycle. As you can see in this particular BBT chart, the temperatures don't spike until day 24 of the cycle, and then the patient gets their period 7 days later. So even though the cycle length is okay, 30 days is all right, they're just ovulating very late in their cycle. So we'll be wanting to make sure that they have enough yang to take over the yin and ovulate earlier in the cycle. Right. I'd also like to talk about the endometrial lining, because if that's less than 8 millimeters, then this is considered too thin. For these cases, Chinese medicine practitioners will advise regular treatments to build blood, which we already talked about briefly. This is especially important in these cases to do in the follicular phase, because blood is often considered an aspect of yin, but the thickening mostly happens in the luteal phase. So for these cases, we'll be building blood throughout the whole cycle. Again, it might take several cycles to improve blood deficiency. So that's a conversation that we need to have with our patients and make sure that they have a realistic idea of what's happening. A lot of patients come to us thinking that they might just get a few acupuncture treatments and then it's this magical fix, but it can take some time. So it's important to get on top of it as quickly as we can, really. All right. So these are all I've prepared so far. They're the ones that I'm seeing the most often in the clinic, but as we all know, there's many other issues that can arise during the cycle. So if anyone wants to discuss or add any experience that you have or ask anything specific, now might be a good time before we move on to the next section. I know people will type in the chat, but do you have any questions, Kathy?
Sorry, it took me a little bit to click on the video button. No, yeah, all good. Yeah, it's great. Carry on. We're just interested to, get those specifics, I guess. I mean, sometimes if we've got women, sometimes we get women watching here who are trying to conceive rather than just clinicians as such. And for those of you who are, and you might have been going, oh my goodness, all these different phases and stuff. I'll tell you a quick funny story, but I remember in my very first year at university doing anatomy and physiology and real basics 101, and we're all in this in the theatre with the lecturer, and we're learning all about the reproductive system. And afterwards, we're sitting around in the coffee shop, a bunch of us, and there's all different types of there's all people who are going to be heading down all different health paths, careers, future physiotherapists, future podiatrists, future nurses, future midwives, etc., all in this basic 101. And one of the guys who was a future physiotherapist, and he said to me, man, did you hear that lecture today? And I'm like, what do you mean? He goes, it went like this. The male reproductive system works like this, blah, blah, blah. The female reproductive system works like this, blah, 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 blah. He goes, oh my God, you guys are so complicated. And so, yeah, if you are, if you don't have a medical background and you're watching this, don't get put off. It says this is the stuff that you don't know, that nobody's taught you yet, and that your cycle, you don't just have a menstruation cycle, you have a menstruation cycle and an ovulation cycle, and they connect all the time. One part of this cycle triggers the part of that cycle that triggers that. And so it is complex, but don't get put off that, and maybe make it a challenge that's what you're gonna set out to learn more about, because it's your body. Anyway, I will be quiet, let you continue on.
So that was well said, Kathy. Definitely, I'm 6 years into learning more deeply about the menstrual cycle, and I still am learning more from every patient every time. So I understand that it can definitely be overwhelming, but engaging in webinars such as these are definitely a step in the right direction. So well done to anyone that's listening. All right. Okay. So my last section is just talking about the cautions that we Chinese medicine practitioners have to take during pregnancy. A misconception that I hear a lot is that because it's natural, it's safe. So it's really important that if you or your patients are seeing someone that does acupuncture or any kind of herbal medicine, that they're seeing someone that understands the fine line between safe and not safe as well. Especially with herbal medicine, people don't really appreciate the fact that all things are toxic in certain doses. So it's really important to speak with healthcare professionals about what you're doing and what kind of therapies you're having as well. Okay, so there's quite a few additional precautions that we Chinese medicines have to take if our patients are or think they might be pregnant. There's certain acupoints and herbs in particular that are known to induce miscarriage. So obviously it's important to avoid those when a patient is pregnant. These kinds of treatments are often what we call moving, which I spoke about a little before. So these are often used in cases of like period pain and other menstrual problems. So it's important to consider where we want to take the patient with their treatment and make sure that they know that there are risks if they continue to try to conceive and also continue with the treatment. So there are options. I definitely believe that if more people were aware of these benefits of acupuncture and of all the different kinds of herbal medicine, they'd seek them out earlier. Where possible, we always recommend a break anyway, to at the very least regroup. As I spoke with Kathy earlier, it's very hard and taxing on the body and the mind to be trying for extended periods of time, especially if you're having any miscarriages or extra disappointment from the times that you don't get pregnant. So we definitely recommend taking a break if you can, just to regroup with your partner, reconnect, because it's so important to make sure that you're still having all of those like regular hormone changes and that all of your neurotransmitters in your brain, like your dopamine and stuff, are going, because it's hard to maintain a pregnancy without those. Stress definitely plays a huge factor in that. Most people who are looking to get pregnant start to see us because they're getting more desperate. I don't know what it's like elsewhere, but in Australia, Chinese medicine is often looked at as like a Hail Mary last ditch attempt for IVF, because IVF is quite expensive, or even because IVF clinics recommend acupuncture often, then they're not seeing us until they've even started IVF consultations sometimes, which makes it really hard for these patients to take a break because they're already quite desperate. And if they've already started IVF consultations, then it's an expensive decision to consider as well. So if they are determined to not take a break, then we can still provide treatment, but we'll just have to focus on nourishing the body or holding a pregnancy if we think there might be one. These kinds of treatments can still help patients, but it's definitely a conversation worth having about which treatment plan is more beneficial in the long run. And if we can, regulate their cycle in a better way and increase their chances of having a healthy pregnancy, then maybe it is worth taking that break for 2 to 3 months. But everyone's different, and yes, so hopefully more people will start to see us a bit earlier so they don't feel as much pressure on them to conceive as quickly as they can, because they've already been trying for 12 to 18 months. It's a long time to be stressed and worried about it. That brings me to the end of my presentation. Any questions or further discussion that you would like to have, please type it in the chat, or Kathy and I will probably keep chatting as well.
Yeah, fantastic. Do you want to leave the share screen
Mhm.
Oh, and can you go over your details, Eve, as well? So if anybody wants to contact you, just because sometimes people are listening to this on
Just
a
listening.
podcast version as well. Oh yes, there we go. So there's that email address. So Eve at Rebalance TCM. TCM stands for Traditional Chinese Medicine. Eve at rebalance@tcm.com. Fantastic. And your website, of course, is www.rebalancetcm.com.
Yeah.
And there's, of course, lots of good videos and webinars that we've got as well on the topic. What do you find is the commonest causes of what a woman would perceive as irregular cycles? Like, what's the thing that you see most often coming in, and how would that most commonly get cured, I guess?
Yeah. So there's so many different ones, but definitely endometriosis and adenomyosis, they're ones that affect the menstrual cycle in particular, but that can also end up making the whole cycle longer, or if their period is longer, then it can shorten their follicular phase or even their luteal phase. So these are things that are diagnosed late often, especially here, because women go in looking for answers about their period pain, but are told that it's normal, or they're told that if they just take some Panadol, then it'll go away. And so they're not even getting the investigative tests that they need until later in life.
Endometriosis has got a dreadful reputation for that, isn't it? When you do the stats, I think it's something like it takes on average, was it something like 6 to 8 years for a woman to finally get a diagnosis, and that's because the system dismisses her.
Mm-hmm. Yeah, definitely. Like, we end up having to see practitioners that work specifically in family planning or something, because everyone else is just like, oh, that's fine, women just have period pain. But anyway, so that's something that we get to see a fair bit, because the very first step is to listen to our patient and say, I hear you have this pain and it's not normal, and we can try to do something about it. Like, that's the biggest thing for them a lot of the time, because no one said that yet.
With a woman, we would say that endometriosis is one of the more common things that you would see as a cause of cycles not working as they optimally should. And most of the time those are women who have had that diagnosis, or are you guys ending up sort of diagnosing it within your investigations?
Yep. So here in Australia, we can order investigative tests, but when we order them, they're not covered by Medicare. So a lot of our patients can't afford that. So they do still have to see their GP for the referral to get the tests. So making that diagnosis officially is not necessarily something that we're doing, but it is something that we recommend they demand answers about if they haven't got them already.
Right. We've got one question come in here from Alison of what would you recommend for lengthening short light periods? I guess there's not like one simple remedy to that, but what generally happens with that?
Yeah, so for short and light periods, that's generally a blood deficiency is what we call it. So that sometimes sounds a bit scary, but really what it means is we want to nourish the body so that it has enough blood to have a full period and a menstruation that's long enough and that you bleed enough. So we'll do acupuncture all throughout the cycle, make sure we're building blood. There's herbal medicines that we can use. There's a lot of different kinds, so I can't really list them for you, but also diet therapy as well is something that Chinese medicine looks into. So you want to make sure that you're like getting enough iron, getting enough protein, making sure that you're getting enough fluids as well. As I said before, blood's a part of yin, which is like all of your bodily fluids. So you want to make sure that you're really nourishing your heart and the organs that produce that as well. Is that helpful?
Yeah, and I would say from a midwife perspective, iron is a big thing because we, it's quite common for women to have their iron, their stored iron or ferritin levels checked with part of their sort of 26-week bloods. But I would have to say that is way too late, and you'd agree, in the pregnancy to be doing a first check of iron. And so I would always get my woman to have an iron, so these are newly pregnant women, get to have an iron stores check done right at the beginning of the pregnancy. And it is absolutely shocking how many people are already iron depleted or anemic, iron deficiency anemia already at the beginning of their pregnancy. And also knowing what their iron stores are at the beginning and knowing what their iron stores are by around sort of 24, 28 weeks, and seeing the difference is also incredibly informative, because sometimes you can have a woman who may, because anything below 20 is regarded as depleted, but certainly in not in traditional Chinese medicine, you guys want them to be sitting at about 100, right at the beginning of a pregnancy. And I would say the average that woman would come in as average that they would sort of score it at the beginning of their pregnancy would be sort of somewhere between sort of 30 and 50. But it's a very few women would come in at 100 right at the over 100 at the beginning of their pregnancy. But again, you get that comparison where if you've got a woman who maybe started at 50, and by 28 weeks she's at 35, so she has depleted a little, but she's actually been doing pretty well keeping up with her needs, and she just probably needs a little bit more red meat, and she'll be, she's probably going to be okay. But when you've got a woman who started the pregnancy at 120 and she's now at 19, that's massive. She is nowhere near keeping up with your needs. So having that comparison is so incredibly useful as well. And of course, as soon as you are low in iron, you're going to be low in hemoglobin, because you need 4 iron molecules to make every red blood cell. So you're a bit stuffed if you don't have them. Yeah, but anyway, we digress.
Yeah. It's interesting that you say that about our preferred iron levels, because certainly that's another area that we see women not really being listened to in healthcare, because they're told, if your iron levels are above 20, you're fine, don't worry about it. But it's not, it's like enough to not be really sick, but it's not enough to be well.
Well said. Yeah, and just because the normal, that's the thing, is that understanding that the normal ranges within Western medicine, Western obstetric medicine, can be very different from the normal ranges within traditional integrative medicine. And there is such a perception that obstetric medicine already knows it all, and they already have all the answers. and they already have all the tools and resources to correct things and fix things. And the truth couldn't be further from the truth. Like it's just not like that. And I mean, I've been a research midwife at university, and if there's one thing that you realize when you're doing studies is that obstetric studies is that the more that we learn, the more we realize we don't have a clue.
Yeah.
And you might do a study in a certain area of obstetric medicine, and that one study results, you go, oh wow, really? That's the outcome? We didn't expect that. And that prompts another study, that prompts another study, that prompts another study. And we probably, of all areas of medicine, we would have to say that probably obstetrics is the least understood. The majority of medicine research over the last couple of hundred years in Western medicine has been around the male body, and even right down to the symptoms of heart attacks. That's all based on a male body, and we know now that women have a whole different kind of set of symptoms leading up to a heart attack that are quite different from the male body. And so we're really very behind the eight ball, and obstetric medicine has very limited tools in its toolbox. Unfortunately, certainly more and more fertility specializing gynecologists and obstetricians are embracing more integrated medicine, and you start to see that on some of their websites, where they may say that also part of their team is an acupuncturist, etc. And you kind of go, oh, hallelujah! They're starting to realize that there's some other therapies that can really help their fertility success rates and their stats if they get their woman doing that. And yeah, so it's a slow process, right?
Yeah.
Guy OBGYNs to always open up to the possibility that they don't know it all.
Definitely. I always am thinking about how relatively new Western medicine is, and by extension, the current obstetric and gynecology professions. There's evidence that Chinese medicine practitioners considered period pain abnormal thousands of years ago. It's still developing as well, as a profession too, and we're learning more all the time. But
yeah. And in decades from now, I truly believe that, I'm not sure when, but in some decades by now, and certainly within 100 years, that integrative medicine and integrative medicine will be seen as the gold standard. So people will, they'll go to a GP doctor, and within that same practice, there will be an acupuncturist and a medical herbalist and a homeopath, and they will all be referring to each other. And I think that people will lead that way, just like IMCO is leading that, the charge on perinatal integrative medicine. We're getting there. It's a slow process. And unfortunately, there's this, inbuilt resistance within allopathic medicine to embrace naturopathic medicine, but we're slowly getting there. I might get you to unscreen that now. So that's wonderful. Is there anything, we are kind of getting to time now, Eve. Is there anything that final that you would like to add before we conclude today?
Yeah, I guess I just want to stress the point of why I wanted to do this is to get people talking about early interventions, to get people talking about how menstrual health is something that is going to affect you later when it does come time for you to start a family. And if you know that there's something not quite right now, start addressing it as soon as you can.
Yeah, that, look, we know that 50% of pregnancies are unplanned, but 50% of them are.
Mm.
And, you know, when you're planning to conceive, you know, just invest you and your partner, yes, your partner as well. But, you know, invest in that 6 to 12 months, you know, ideally 3 to 6 months for him, and ideally 6 to 12 months for her. And invest in that, and make sure that you've got the optimum cycle, the healthiest sperm possible, the healthiest egg possible, the optimum womb lining possible, all of those things. And also, you know, we know with the more that we're studying in epigenetics, which is, you know, like preconception genetics, the more we're realizing there's huge long-term implications for that child for that baby going on to childhood and adulthood with their health. So yeah, and also just the whole trying to prevent that incredibly emotional journey of recurrent miscarriages. And you know, we know that around 40%, I think Julia from your practice has explained that, you know, around 40% of infertility and subfertility issues are sort of female body related, about 40% are sperm related, about 10% are both, you know, and about 10% are unknown. So we can't emphasize enough that the value of investing in preconception healthcare by engaging with a maternity naturopathic practitioner. Okay. But look, thank you so much, Eve, for being here today, and we really appreciate it, and supporting women to try and understand their cycle a little bit more before trying to conceive. And thanks to those of you who are live as well. We know a lot of you are watching this down the track, but thanks to those who popped in here live as well. We always like our live audience. So bye to everybody, and I want to wish everybody a wonderful rest of their week. So thank you, Eve.
Thank you. Bye.
Bye, everybody.